Welcome, everyone. It's a real honour and a privilege to be able to host this webinar event on behalf of the Teeswide Training Hub, thinking about Mental Health Awareness Week, which is coming up next week. We've been involved with Let's Connect for over 10 years, delivering in a variety of training as part of Golden Tree Wellbeing CIC. And it's just a real pleasure to sort of be thinking about this, particularly as we think about sort of the main topic of Mental Health Awareness Week, which is around anxiety. Now, just a couple of things before we sort of move on. The event is being recorded, just so people are aware of that. If anyone has any concerns or comments, if you pop that in the chat box, then Mark or Claire, who are ably supporting us in the background, managing all of those things, they'll respond to you in terms of what needs to happen there. But yeah, it's great to be here. As I said, it's a real pleasure to be introducing this main theme and thinking about anxiety. Now, the Teeswide Training Hub has been in existence now for a considerable length of time, and this event in itself has been supported also by the South Tees Wellbeing Network. There's more about that on the website, but it's a virtual network in South Tees, and it's there for employees and volunteers from health and wellbeing services and all other organisations and groups. It's about connecting, it's about exploring, and it's about acting on local wellbeing issues together. So it's a superb initiative. Local workers and volunteers at any level can join this network, and if they're operating within South Tees, from all sectors, health and wellbeing services, whether that's in healthcare, the local authority, charities, or voluntary or private sector. So it's a really positive and I suppose powerful tool for getting the messages across around sort of mental health, mental illness, well-being, a whole host of issues there. Now, just want to do some introductions because we've got some really interesting speakers coming up this afternoon. You know, quite a tight time frame for people as well. So I've already had a warning off my business partner Sandra saying, so don't talk too long, Simon. So if she could have a shepherd's crook, I think she was be there. So I've got that virtually in my mind. But yeah, really looking forward to this. Anxiety is something that's actually really close to my heart. As well as working at Golden Tree, delivering mental health training, I also work as a psychodynamic counsellor. And anxiety features very large in the therapy room. And one of the things that's actually really interesting about that is that sometimes people will come and say, what is wrong with me? And very much we are thinking about what's happened to people. Anxiety is something that people experience in connection with something that is going on in their lives. So I'm really interested to see the things that we are going on within our local community around this and around frameworks and sort of contextualizing and thinking about mental health and the construction of the language around it. And we've got Dr. Catherine O'Neill, who's a clinical psychologist and principal lecturer at Teesside University. And she's going to be discussing the development of a framework around mental health. And so I'm really kind of looking forward to hearing what she's got to say. And then we've also got Sarah Murphy, who's a senior health and social care lead. And that's around money and pensions and thinking about that. So the links between mental health, anxiety and money. And that, again, is something that's been very prevalent over the last few years, particularly with the cost of living crisis. Then, following on from Sarah, we're going to have Stacey Sowerby and Gemma Castle talking from the point of view of benefits and debt. Stacey and Gemma are from Stockton CAB, Citizens Advice Bureau. And so again, really interesting. These are issues around anxiety that are very real. You know, stuff is happening in people's lives, and it's right that, and thinking about the words I use here, but normal, absolutely normal for people to feel certain bits of anxiety. Then Ian Meredith from Impact will be talking about grounding techniques, something that I found very useful today, as I've had loads and loads of IT issues with my internet connection sort of dropping out, my computer not loading up. Actually, I found a grounding technique really useful. So again, I'm very keen to hear Ian talk about that. And this is actually really interesting. This is very relevant and what a lot of the dialogue is at the moment around trauma-informed practice and trauma-informed things. What has happened to people? And Amanda is the lead within the Trauma-Informed Project and Recovery Solutions. And she's going to be talking about something that I think is absolutely fascinating. Links, I think, with what Ian's talking about in terms of grounding. But Amanda's going to be discussing the vagus nerve and some quick and easy ways to manage anxiety through techniques that help the vagus nerve and the vagus nerve in terms of an anxiety response. Really, that whole idea of polyvagal therapy really sort of gaining traction and very beneficial to people. So then, and this might be difficult, but we're going to hold off answering any questions until all the speakers have spoken. And then we've got some time to talk about and answer some of the questions. The panel will be coming back in and we'll be talking and answering questions. So anything that you've got, any more information that you would like or comments that you would like to make, please pop them in the Q&A box as we go through the session and we'll get to them. We're really lucky again to have Claire, who's going to be looking at these questions and collating them, because I'm guessing there will be things that are similar in terms of some of the things that people want to know. So very excited to be here, very excited to think about the things that we're going to talk about. And so without sort of further ado, if we're able to actually hand over now to Dr. Catherine O'Neill, from clinical psychologist and principal lecturer. I noticed on your window there, Catherine, you've got Cat. So apologies. Is it Catherine or Cat? What would you prefer?
My day-to-day name, or Catherine's my Sunday name.
Your Sunday name.
I'm happy for any of them, to be honest.
Yeah. Okay. Well, we're going to hand over the sort of power to you to do your slides now.
Oh, it's saying that the host has disabled participant screen sharing.
Oh, no. One of the things I think is absolutely marvellous, oh gosh, I have to be careful here. The pandemic has made people, I hope, a little bit more tolerant of IT issues. And I am pretty sure as we go through this event, there'll be that phrase that we didn't use 3 years ago of "you're on mute" as we go
every time.
So yeah, and I also think it's interesting about we notice what's actually happening to us in any given moment as we look at this, the anxiety and the tension that we feel. So anyway, enough jibber jabber from me, Kat, and I shall hand over to you. So
thank you. So my name's Kat, and you may also see a cat, often just one of the other sort of Zoom bingos of "you're on mute" and "there's a cat about to arrive." So thank you for your patience. Unfortunately, at the moment, I can't share my screen because the thing is covering it. Let me just see if I can hide this. There you go. That's it. Great. Okay. So my name's Kat O'Neill. I'm a clinical psychologist, but really I don't think of myself as a very good clinical psychologist, because I think deep down what I am is a community psychologist. And what I'm interested in is how the kind of environment around people affects how they feel. And anxiety is a topic that's very close to my heart as well. I worked for Anxiety UK, which was a service user-led mental health charity, for 5 years before I did my clinical psychology training. So what I'm referring to when I talk about anxiety here is, I guess there's a continuum of anxiety that you know, I know that anxiety disorders are very significant mental health conditions that can cause people to experience significant impairments, all the way back through to the daily stresses and strains and anxieties that we may all be feeling at the moment in the post-pandemic period. So I just want people to acknowledge that there is a difference between those things, and some are at a much more severe end of the continuum. I don't want to minimise people's experiences. So yeah, so community psychology approaches to anxiety. We're going to look at what that is. We're going to look at how we would understand it from a community perspective and how we're going to tackle it. So community psychology, as I see it, I'll talk to you about some of the defining features in a moment, but I guess it's the idea that whilst therapy and medication and individual interventions can be extremely helpful for people, actually community psychology is interested in those wider factors that are impacting on people, and thinking, is there things that we can do to try and address some of the causal factors around people's anxieties and stresses, rather than just intervening with them on an individual basis. And as it says in that, we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in the first place. And so some of the principles of community psychology, it's an area where there's some debate around exactly what it means, but what they would tend to look at is the interaction between the person and the world around them. So their families, professional services, the wider culture, the government. It's interested in sharing psychology. So I like to think of it as, if you're my age, you might have seen The Wizard of Oz when you were a kid. And there's a bit where at the end they go and find Oz the Great and Powerful, and he looks like this giant genie. And sometimes I think that's what psychology is like a little bit, that we look like we use all these fancy words, and it kind of makes us seem like we're this all great and powerful person. But when you look behind the curtain, it's usually just somebody pulling a few levers and strings, and it's just an ordinary person. So one of the ideas in community psychology is, how do we bring psychology out from behind the Oz the Great and Powerful kind of facade and share that with communities so that they can use it as well. We're very focused on partnership working, so it's about working with community organisations, working with individuals within communities. Again, it's that idea of prevention, so it's stopping people falling in the river rather than pulling them out of it. It's about it's thinking about issues of power and ensuring that people are included in society, that it's not just you know, giving everyone the same chances. It's thinking, what do people need to be able to participate fully in society? And that it's about trying to encourage people to take collective action, not just dealing with their own issues on their own. So things like service user-led groups, or community groups that are led by people with lived experience, etc., would be part of that potential collective action. And it's meant to be about transforming the system, not just making people better within the system. So that's community psychology in a nutshell. And the way that we this is often a very complicated diagram, but what I try and help people to see it as is like ripples in a pond. The person's in the middle, and we have the micro system, which is the environment around them. We have the meso system, which is like how different aspects of the system interact. The exosystem, which is like things that the person isn't immediately affected by, but still has an indirect effect. And the macro system is our wider culture. And when we think about things like anxiety, in this context, you've got so just imagine in the micro system, you've got people's family members. So, for example, some of you might know that anxiety can be passed down. Well, it's often found in families that maybe through modeling behavior, or, you know, for example, there's a very simple anxiety would be a fear of spiders. If a child sees that a person's parents frightened of spiders, then they might be more likely to be frightened of themselves. It's a very simple example, but so that's the microsystem is affecting that person's mental health. It's coming from outside them, for example. The exosystem could be to do with things like the media. I'm going to show you an example on the next page of how the media might sort of perhaps create a sense of anxiety in us because of the uncertainty, or highlighting some of the difficulties that are going on in society at the moment. So that might cause anxiety within us. And then we've also got the wider factors that have been going on culturally. So just as an example, you know, think about what's been going on over at least the last 3 years that might be affecting us, that aren't to do with anything being wrong with us particularly. It's to do with what's going on in the wider community. So we've got, you know, tensions around the possibility of war. We've got a cost of living crisis. We've had a global pandemic. And, you know, there's been gas and electric prices. So the background levels of stress and anxiety in society are going to be affecting us. We've also got problems, difficulties within local services, not just local services, national services. We've got staffing and recruitment crises in frontline services. We've got staff members that are experiencing a lot of stress and anxiety within their roles too. So there's a lot of stuff going on around people which may be contributing to their stress and anxiety, which isn't necessarily about what's just going on within them. So what can we do about this? Some of these drawings, by the way, from some of my favourite psychologists. This is from the Psychology Mum. She does loads of really great accessible drawings. So this is the capacity cup. So what we know is if we're feeling stressed and anxious, then we need to find a way to empty our cup. If otherwise we're going to feel anxious and overwhelmed. So we have to try and think about, is there a way of stopping more stuff going into our cup? Is there a way of throwing some of the stuff, the stresses that we've got out of our cup and not having to deal with them? Can we work out what's filling our cup up? What are the things that are causing us more stress or most demands on our time, and try and reschedule things? That's kind of individual intervention that we might do around managing the stresses that come. But we also know that social factors can really weigh heavily on mental health outcomes. So things like the place you live, loneliness, food insecurity, poor quality housing, and also that they can have the opposite effect when they're positive: safe places to live, social support, trauma-informed care, financial security, etc. And so there's this idea coming through. It's through public health, but I think it's got a lot of resonance with community psychology about how we can address health inequalities and the adversities that people are experiencing through taking a more collective approach or a community-based approach. And they call this creating health. So it's including communities in decision making, supporting community development, empowering people, building trust with the local community. And they've said we cannot treat our way out of ill health. If we don't harness the system, work with the power of employers, networks and communities, then health inequalities won't improve. And this is just an example from one of the organisations, the New NHS Alliance, that's suggesting that we can take a place-based approach. And I know that's something that a lot of people are working towards in the local community in Teesside. So it's thinking about how we as a system can change some of the issues that are happening around people. So, for example, it might be, this is specifically around looking at work, but it could be about peer support. It could be about people who understand the problem from a more systems perspective. It could be that we have self-organising communities, we support volunteering, we have commissioners that understand their community, and we map the existing community infrastructure to look for the strengths and the assets within the communities that we've got. I'm going to be dead quick now because I know I've probably only got about a minute left. So the local picture we've got, not just in Middlesbrough, but in the Tees Valley area, this is just a snapshot of some of the organisations that I work with. You might not be able to see too many of them, but we've got, you know, we're really well resourced actually in Teesside and in the different areas. We've got some fantastic organisations working in mental health. I know we've got Red Balloons and Impact, as well as Let's Connect, etc., working in these communities. We've got lots of interesting cultural organisations that work with global majority clients. We've got domestic and sexual abuse organisations, etc. So there's a number of organisations already, great assets working with communities. And as I said, this is just a snapshot of people that are working locally. And there is an evidence base for community interventions for anxiety. So there is some evidence, although more evidence is needed, for the use of music projects, community music, community exercise projects like Red Balloons, community gardens and gardening. And there is strong evidence of a small but reliable effect on group peer support in terms of recovery from mental health difficulties. So that's what I'm interested in, is how do we not just look at like the individual aspects of a person's problem, there's the cat, but also look at the wider factors that are contributing to this issue and how we can work together as a system to try and address some of those issues. And I'll hand you back to Simon, because that was my final slide.
Wow. Well done, Kat. That was fantastic. And it's just so exciting to hear about the stuff that is going on. And I really love this idea that we are taking anxiety and indeed mental health issues. It's not just the things about the individual or the individual's sort of personal attributes. We are looking at what's going on in the community. And absolutely fantastic that you mentioned sort of the amount that's out there. And we're really lucky, actually, a little bit later on, we're going to have more information about the South Tees Wellbeing Network as well. And you also mentioned red balloons. We're going to show a little video about red balloons as well towards the end of this session. So absolutely fantastic. Well, I thought my internet connection had gone there when it all changed, when the screen went. So you might have seen my face go, oh no, I thought I've been kicked out again. Could be one of those days. Yeah, Kat, that was absolutely fantastic. And I know that I have loads of questions for you. I have loads of questions that I would like to ask. But I'm going to hold back on that and see what comes from that. And I'm now going to take the opportunity to hand over to Sarah Murphy, who's the senior lead and senior health and social care lead and money and pensions now. So Sarah, welcome, and looking forward again when we think about what's going on in that river around the sort of pressures that people have and how choppy the waters can be. Great metaphor to use, I think, a river. So yeah, welcome, and I'll hand over to you.
Thank you. Can you see my slides all right? I'm in the same boat as Kat in that I'm fumbling around trying to make sure I'm pressing the right buttons. Great.
Yeah.
Okie doke. So yeah, thanks ever so much for inviting me here today. That was really interesting. I wrote loads of things down actually as you were speaking, Kat, because I think there's a lot of crossover in terms of what I'm going to be talking about as well. But I'm Sarah Murphy, and like Simon said, I'm the Health and Social Care Strategy Lead at the Money and Pension Service. And if you haven't heard of us, we are one of these arm's length bodies of the government. We are funded by levies on financial services firms, so banks and pension providers and whatnot pay a levy. And we've been set up to support everyone across the UK with their financial well-being. And that's everything from pocket money right through to pensions. One of the things that we do, or one of the services that we provide, is a service called Money Helper, and I'll talk a little bit about the resources that's available from that service in a moment. But my role, very specifically, has been set up because there are links between our money and our health, and so I've been beavering away trying to support different folks across the health and social care sector to be able to have that awareness of the fact that the issues that money can play with our health, and also develop some tools and resources that might be able to help them do that. So what I'm going to cover today is a little bit about the links between our mental health and anxiety, obviously in particular, given that's the theme for Mental Health Awareness Week, and money. But then quite swiftly move into some tools and resources, some practical things that I hope you will find helpful when you're working with your clients or patients or service users. So in terms of what we know, there's various bits of data that really kind of highlights the links that there are between our mental health and money. Every 3 years at the Money and Pension Service, we run a really huge adult financial wellbeing survey. So we survey over 10,000 people across the UK. And we ask various questions about how they're getting on with money in terms of saving. Are they managing to keep up with their bills? Are they using credit? Are they planning ahead for their retirement? Whole gamut of questions. And one of the questions we asked is around, are you struggling to keep up with your bills and payments? So just in terms of the UK population, 50% of adults said that they were struggling with bills and payments. And bearing in mind, this was 2021 when we did the survey, so cost of living hadn't really taken full effect at that point. So we suspect that it probably will be higher now. But when we look at that same data set and we see the number of people who also said that they had experienced a mental health problem, then that figure jumps up to 74%. So 74% of people who'd experienced a mental health problem were also struggling to keep up with bills and payments. We also know, and this is from analysis of the adult psychiatric morbidity study, which is a great big study as well. It's quite old. They have just done one recently, but the data hasn't come out yet. So this is from about, I think 2019 is when the analysis was done. But that also found that of all the people that said they were in problem debt, half also had a mental health problem. We also know, however, that people avoid talking about it. And before I joined the Money and Pension Service, I worked for 12 years for a mental health charity. And I think over that 12 years, there was clearly great strides in people feeling more open and more comfortable talking about their mental health, although there's undoubtedly, still stigma around that. But there just seems to be this extra awkwardness when it comes to talking about money as well. And I think when it's both mental health and money, there's almost a double stigma attached to the two, and people just feel very guilty, very shameful, very embarrassed, and just avoid talking about it. And I guess this is painting a bit of a picture that it's more likely if you're struggling with your mental health, you'll also be struggling with bills and payments. If you're in debt, it's going to be impacting on your mental health. But if you're not talking about it, you're possibly not reaching out and getting any support. And then sadly, we also know that about 13% of people who are in problem debt have also thought about suicide. And certainly from my past experience, it's this vicious cycle that people get into, where it could be that because of symptoms of a mental health problem, that might make making decisions or managing money day to day a bit more difficult, which can kind of spill over into a money problem. But also kind of living with different health conditions can mean that earning money is more difficult. It might be that you're in and out of work because your health is fluctuating, so that in itself can lead to money problems as well. But also if you have a money problem, that is very stressful. It's a very real issue if you're worrying about losing your home, or bailiffs coming knocking on the door to take things away from you, or you're having to make really hard decisions about what you spend your money on. Do you put the heating on, or do you buy food for the family? So that living with that sort of stress is stressful, and that can then kind of lead through into people experiencing different mental health problems. And I'm not going to labour this slide because there's people far more qualified than me on this call today about anxiety. But like Kat was saying, there's lots of things falling into our capacity cups or our stress buckets, which cause us to worry, and finances are a huge part of that. So I would say that worrying about money, particularly when there's very real things to worry about, like I was just saying, shouldn't necessarily be seen as an anxiety disorder. But then when it comes to anxiety and money, again, as you probably already know, sometimes the symptoms of anxiety can include that, making it a bit more difficult to concentrate. You might be feeling quite overwhelmed with the thoughts racing in your head. It might mean that you aren't sleeping very well, and that can also then impact on sort of how you're thinking, and that sort of brain fog sometimes that comes from being very tired. And it can also bring about different physical symptoms as well. And if we think about then how that can impact on managing money, if letters are coming through, whether it's from your energy provider or the bank or the council, then it can be really difficult sometimes to understand them. Sometimes they're hard enough to understand as it is, but if you're already having problems concentrating or feeling quite overwhelmed, then it can be quite difficult to understand those documents. It can mean that it's quite hard to make a decision, and certainly in my experience, avoidance was something that people did quite a lot, where they would maybe feel better if they just put the letter in the drawer and didn't make a decision or take that step around dealing with the money problem. But obviously the money issue didn't go away. But also it can make it really hard for people to take those first steps and to engage with organisations who might be there to be able to help, whether it's the energy company or the council themselves, or whether it's going to seek some money advice. So in terms of sort of practical tools and resources, so we've known all of this stuff about the links between mental health and money for a while. And what I did when I joined the Money and Pension Service was I surveyed a range of health and social care professionals to say, well, how confident are you talking about money? What kind of tools and resources would you find helpful? And it was a bit of a mixed picture in terms of confidence. Some people obviously were more confident than others. The majority, though, about 80%, hadn't had any training that was relevant to their role about money. And in the main, what people said they would find useful would be resources that they could provide to the person that they're working with, and also services, trusted services that they could either signpost or refer to. So we've been working on a number of initiatives based on that feedback that we hope you will find useful. So first up, we've worked with the Office for Health Improvement and Disparities on a really short e-learning module. It only takes about 15 minutes to complete, on financial well-being. And it's free. You don't have to be an NHS staff member to access it. And the links on the slide there. And it's essentially broken into 3 different modules. The first one really highlights all the links between health and money, so a little bit like I've just covered there with mental health and money. And the main module really is kind of stressing, as a health and social care professional, it's not your job to suddenly become a money advisor. But if you're able to just have that awareness that money might be having an impact on the health of the person that you're working with, and feel able to ask them whether they would like to talk about that. If they do, offer to assist, and if someone wants to be helped, act and sort of get somebody to the right source of support for their money problem. And then the third module is a range of different tools and resources that again that you might find useful. If you do ask and you offer to assist and then you act, and if you don't know where to signpost somebody, particularly maybe if they haven't already got into debt and they've just got some general questions about money, please do signpost them to the Money Helper service, which is the service from us here at the Money and Pension Service. So it's totally free, it's impartial, and it's kept up to date, and we've got masses of information on there about cost of living in particular. And we've also just launched a new benefits calculator, so people can type in a few bits of information about their situation, and it will tell them or suggest which benefits or sources of financial support that they might have available to them. As people who are working in sort of the public sector, there's also some printed guides that you're able to order for free, so that you can actually give them out to the people that you're working with. And we've got one that's just launched about help with the cost of living. And we've also got posters which you can download and print out for free, which just sort of raise awareness of the service. And that they can be quite handy for service user areas, but also for staff areas sometimes as well. And I'm not going to labour these slides, they're more just for your benefit after the session today, but there's the Money Helper service is online, but it can also contact us over the phone, on WhatsApp and web chat. And if anyone's got a pensions question, it's a slightly different team of pension specialists who answer those questions, so the phone number and the web chat is a little bit different for the pensions team. The next resource isn't something that we produced, it's something that a mental health charity produced, but we've been supporting them with it. And it's a mental health and money toolkit. And it tries to take that pincer approach of helping people both with how they're feeling about money and providing some money guidance as well. So it was co-produced with people with lived experience, And the mental health side of things was written by a senior psychological wellbeing practitioner. And you can either work through it with the person that you're working with, or they can work through it on their own. And the first half has a number of cognitive behavioural therapy techniques or exercises that they can go through for building self-esteem. Like I said, the main thing that they reported back was that they just felt quite guilty and embarrassed about struggling with both their mental health and money. And also there's some techniques in there about dealing with avoidance. And then the second half of the toolkit has some basic money guidance information in there, including a little income and expenditure form that people can write into, so they can pop their income and all of their outgoings down there. There's a section on preparing for a welfare benefits appointment, and there's also a section on different kinds of free debt advice that people can access as well. So the toolkit is available as a PDF. The link again is on the slide there, but we're supporting the charity by, we've had some printed that we can send out to you guys for free. So if you would like some, just send us an email to the email address on the slide there. Let us know where you want them sending, how many you want, and we'll get some out to you. And then the final thing from me, we've also been working with the North East and North Cumbria ICS to develop a new tool, which is essentially a tool that mental health professionals can use to ask questions about the different types of money issues somebody might be experiencing. And then depending on the answers that they give, there's a range of different organisations, trusted organisations, that they can then signpost to. So we're actually launching this next week on the 17th of May at an online event, but similar to this one. It's at 9:30. And so if you would like to come along and find out a bit more about that, please do register. And again, the link's in the slide, and I think they'll be shared with you afterwards. So that's everything from me. I'll hand back to Simon, but otherwise, and I'll be here for questions at the end as well.
Sarah, thank you so much. Again, absolutely fascinating stuff. You know what I'm struck by already is just the amount of support and information that is out there of a really high quality standard, you know, so that there's, and I was really kind of really pleased to hear I don't need to be the expert on money. And anyone that kind of looks at my bank account would go, yeah, you shouldn't be giving advice out at all, Simon, on that. And I wouldn't, but I know against that signposting, isn't it, there are people that can help. And I'm very much struck by what you said about this sort of the difficulty that people have talking about these money issues and the stigma, and you use the term shame. It's such a powerful thing that impacts on people. And again, with the choppy waters that are there at the moment in terms of the cost of living, yeah, it's none the wonder that people feel anxious, that people do feel stressed about this. So thank you so much for that. Yeah, we'll look at the mechanism of actually sharing the slides and the links to get to particularly that web event, and for people to be able to download. I've made a note of them already. I'll be downloading them straight after the event as well. What powerful and useful resources to have. So thank you very much for that. So now our next speaker is Stacey Sowerby. Are you just on your own, Stacey, or is Gemma?
Yeah.
You're just on your own.
Yeah.
Well, there we go. We are here in the background, wishing you well. So I'll hand over to you now, Stacey. And yeah, thanks very much.
Thanks, Simon. I'm Stacey Sowerby. I'm the Training and Project Manager for Stockton Citizens Advice. And I'm going to talk a little bit about benefits and debt today. They are huge advice areas, so I'm only covering a little bit, but I will be available for questions at the end. As we've already mentioned today, we are in a cost of living crisis, and that impacts us all. But for those with mental health issues, it has further increased their anxiety. So what we try to do with our clients is look at a number of things to help them through the situation. So we look at maximising income, and there are a number of ways that we can help them maximise their income. That can be through claiming benefits or looking at government support through the cost of living payments. If they're working, checking to see whether that they're being paid the right wage, that they've got the right tax codes, that they're getting tax rebates that they are eligible for. We help people apply for grants for charities for help with their furniture, for clothing when they can't afford to pay for that. We also look at whether there's any child maintenance to see whether we can increase their income there. If people are struggling to pay for their rent, we help them apply for discretionary housing payments through the council. And we can also look at budget and loans and advances to try and help them get what they need, but they are loans, so they do need to be repaid. Next time. With benefits, there are lots of people who are missing out on the benefits that they're entitled to, so it's always worth checking whether somebody you're working with or yourself can get further benefits. So it might be that you're able to claim new benefits or increase your current benefits that you're getting. So for people of working age and on a low income, there's the potential that they can get universal credit, help through their council tax. They may be getting some old style benefits that they're not getting the full amounts on that they should be getting. Interestingly, there's 1 million people missing out on an average of £9,600 a year on universal credit. That's a huge amount where their income could be topped up and can help them with those essential bills that are too expensive at the moment. We work with a lot of people who are sick or disabled. So we look at benefits like employment support allowance, where they've got a limited capability to work at the moment. We look at benefits like personal independence payment, where they struggle with their daily living and their mobility. We look at child disability living allowance for those parents who have got children who have got extra care and support needs. And we do look at attendance allowance for those who are over state pension age who struggle with their daily living and their care needs. We help people of state pension age who are on a low income. So we look at things like pension credit, help with council tax again for them, as well as the disability benefits. Carers are missing out on, there's 500,000 carers missing out on carers allowance who are eligible for it, who are providing unpaid care for the people that they're looking after, which tend to be their family and friends. So we help them make claims such as carers allowance, get them additions on other benefits that they're currently getting. And we help people who are responsible for children. So we look at child benefit, universal credit for them and see what they can get to top up their income. As well as topping up people's income, we also try and look at reducing their spending. So they might be able to save money on their council tax. There is help with council tax through council tax support. There are discounts available, so there's single persons discount. There's a severe mental impairment discount if they've got quite severe mental health issues. There are disability discounts if they've had to adapt their home due to their disability. We can help people in terms of their water bills. So we look at whether it's beneficial for them to get a water meter fitted. We talk with them about social tariffs that are available through Northumbrian Water. So there's 5.7 million people missing out on the social tariffs through Northumbrian Water. So that's fewer than 2 in 10 people who are getting the help that they're eligible for. We look at switching in terms of broadband, TVs, phone deals. Now, if people are in a fixed term contract, there would be penalty fees for that, so they would need to weigh up whether they can switch at the moment. But there's also social tariffs available for broadband for people who are on certain benefits. And only 3% of those who are eligible have signed up for this help. There is help with energy that we also look at. Currently, it's not worth switching at the moment, but that is going to change over the next few months. But we look at energy efficiency measures with our clients, and we look at any other discounts that they may be eligible for, such as a warm home discount. We also look at help with essential costs. So we've provided a lot of advice over the last year or so in terms of cost of living payments and who is eligible. We've helped people make claims for benefits so that they then become eligible for the cost of living payments. We have helped people with fuel vouchers, and there are other organisations who can help with fuel vouchers for those who are struggling to top up their meters. There are warm spaces throughout Stockton-on-Tees. We help people access food banks and community pantries, and we also provide advice in some food banks and pantries in the Stockton area. We can refer people to Stockton Borough Council for their welfare assistance scheme who need some help with gas and electric, food and other costs. We give advice in regards to Healthy Start vouchers for those who have got children or who are pregnant and are getting certain benefits. That can help with the cost of vitamins and fruit and veg. And then we advise people in regards to help with health costs that they can get if they're getting certain benefits. I've gone into a little bit more detail about the cost of living payments. So you'll get a cost of living payment if you get certain benefits. So that's universal credit, some of the old benefits such as job seekers allowance, employment support allowance, income support, tax credits, or if you're getting pension credit. Those payments are currently £301 and they're due to be paid now up to the 17th of May. But people had to have been entitled to those benefits between January and the 25th of February. So if people aren't getting those benefits currently, they would not be entitled to this cost of living payment. There are further payments that are due later in the year. Those dates are not set. The eligibility dates are not set for when you need to have claimed a benefit, but those payments are £300 and £299. There's other cost of living payments for those who've got a disability. So they need to be getting personal independence payment, attendance allowance or disability living allowance. Those payments are £150 and they're due to be paid in the summer. And for those over state pension age who also get a winter fuel payment, there's further cost of living payments of £300 to £150 that are due to be paid in November 2023. They're very similar to what was paid last year. Another area that we provide a lot of advice in is debt. So there's rarely one single life event that causes debt. It's often a series of events and actions that are usually made by life events or surrounding circumstances. So some events are poor mental or physical health. The fact that you may not be able to work or you may be off sick can contribute towards debt. The rise in living costs, reduced or stagnating wages that aren't rising in terms of the cost of living. There could have been a relationship breakdown that's impacted upon your finances, a loss of employment. There's gambling and other addictions that can cause debt, and the ability of somebody to deal with their financial situation and understand what is available to them. So the effects of debt, they are legal effects of debt and they're also social and personal effects of debt. Legally, it affects your credit rating, your ability to borrow in the future. You can lead to a disconnection of your services, such as your gas and electric, and being cut off if you can't afford to pay your bill. There's a loss of job, a loss of your home if you're in rent arrears or mortgage arrears, and in some cases, you can be imprisoned for certain types of debt. Socially and personally, there is a stigma associated to debt, which Sarah mentioned in her presentation. It can lead to relationship breakdowns. It causes significant stresses in a relationship. It can lead to poor health, in particular mental health. So it can cause poorer mental health in those who already have it, or it can contribute to mental health issues. Again, gambling or addictions can be made worse by debt, and it can influence your behaviour and how you behave with other people and what you choose to do. Sarah's already mentioned, but debt can lead to suicide. It does have an impact, a large impact on suicide. So it's relevant that mental health and money should be together, that services dealing with mental health problems should also be talking to people about money and referring them into the services that can help them. So there are a number of things that can be done in terms of debt and how we can help our clients. There's informal solutions. So there's payment arrangements that we can help make. We can negotiate to get the debt wrote off. We can apply to charities to help those payments. And we can look at debt management plans with clients. There are other more formal solutions. So there's debt relief orders, bankruptcy, individual voluntary arrangements, and varying payments under a judgment through court. We would always advise people to get advice either from us or through a free debt advice provider. We currently have a mental health project and we work with TUV and within TUV offices, And we've worked very hard with TUV on incorporating questions regarding benefits and debt into their meetings with their patients. And what we found is it's helped reduce people's mental health and helped make them more confident and resilient. So it's doing a fantastic job, and it just shows how it's all interconnected and related. I do have a few figures there, but Sarah's done a lot of them, so I'm not really going to labour on this slide. But 72% have said that mental health made their financial problems worse, and almost 3 in 4 people have said that their mental health is impacted by a visit from a bailiff. There is help available. So in terms of benefits and debt, you can seek advice from Stockton Citizens Advice, Stockton Welfare Rights in regards to benefits. There are benefit calculators that people can use themselves to see if they're entitled to anything else. And we have a very detailed public website that I haven't put on there. That's really good for people to see what's available and how they meet eligibility for things. In regards to debt, there's debt and mental health evidence forms, which health practitioners can complete. That helps us in order to write off debts and challenge debts with people. You can make a referral to Debt Help, so the Citizens Advice, National Debt Line and Christians Against Poverty. And there's also a mental health crisis breathing space for those who are receiving treatment. And that helps them, it means that the creditors can't contact them for a certain period of time, which enables us to try and come up with an arrangement with our client and how we can help them and let them choose an option of how they wish to progress. Do questions at the end.
Stacey, thank you so much for that. I think it's really interesting. It ties in so lovely with Sarah's presentation as well about the impact that sort of debt and financial worry can have on. And I noticed, and I invite sort of the participants, the attendees, just to think about what's going on for them as they listen to that. Because I noticed a sense of tension in me when we talked about the impact that debt has. But then I also have this image and harken back to what Kat said earlier on about the cup, the stress container, the stress bucket model, of how much support there is available to help people take those really weighty things that you were mentioning out of that stress bucket, and feel that some of that tension kind of going. So absolutely fantastic again to know that the help is there. I'm sure again I can see lots of comments coming through about how informative that was. So that's brilliant, Stacey. But I'm going to without any further ado, I'm going to hand over now to Ian Meredith, who I hope is going to help us with maybe a grounding technique or two, which I'm looking forward to. So over to you, Ian. Thank you.
Thank you very much, Simon, and thank you very much, everybody, so far. It's been absolutely fantastic and very informative. What I'm hopefully going to be doing now is kind of strip things right the way back to basics, if that's okay. We've had lots of really kind of informative information about lots of different holistic areas where we can try to support ourselves in relation to the theme of today, which is obviously anxiety. But I want to bring that right the way back to ourselves. So I work for Impact on Teeswide, in relation to mental health support, primary kind of counselling, talk and therapy service. But I specifically actually work for the Recovery College, a pathway where we look at how we help people to develop skills, knowledge and understanding on mental health and maintaining mental health and well-being. And so what we're going to be looking at today really is, as I say, is something very kind of foundational, and that's grounding techniques. Now, for some people who are participating today, you might have heard about these and you might actually roll your eyes at something we're going to discuss and think, oh, well, this is just kind of basic and straightforward. And absolutely. And we want it to be so, because when you think about anxiety, when you're in the middle of it, when you're experiencing panic and full-blown attacks and things, then it is very, very difficult to be able to think yourself out of things and think, well, I'll just do this and I'll just do that to help ourselves. So actually what we're talking about is something that may be preventative, and that could be really, really useful. So I am going to share some slides just now, just to kind of go through what we're talking about. But just to kind of reinforce that idea of what I was saying, it's about empowerment. It's about the individual. It's about figuring out what works for us. And if I just get my PowerPoint up there. And the key to this is this thing which we're going to be talking about specifically within grounding. It's important to remember that trying to practice these exercises, it can be a persistent thing. We need to really figure out what it is that works for us. As I mentioned before, I work in recovery. We use a thing called the CHIME model in relation to help and mental health. C stands for connection, understanding we feel part of a community and we know who to go to for support. H stands for hope, the idea that things can improve and we can make ourselves better. I stands for identity, knowing who we are, what works, what doesn't work. Very, very important in relation to what we're talking about. M stands for meaning and purpose, you know, knowing what we're getting up for in the morning and what goals we have to achieve. And then, of course, the E stands for empowerment. That idea that we can do things ourselves. Now, obviously, no person is an island. And of course, it's all very well me saying that, you know, it'd be great if we can help ourselves. But also, you know, we do need help every now and again. And that includes, you know, if there's something wrong with your house, you may go to a builder. If your car breaks down, you go to a mechanic. If you need physical health support, you go to your GP. And hopefully, if you have mental health issues, you may go and seek mental health support as well. But it is nice to know that there are things out there that we can do to help ourselves, of course, such as grounding techniques. Now, sorry for reiterating something that's been mentioned several times already, but I think it's important in context to what we're talking about in relation to the actual techniques. You know, it's important to understand that anxiety can cause things like overthinking, rumination, disassociation. You know, you might feel a little bit spaced out, or you don't feel quite right in the moment, or even hypervigilance, those times when we're really jumpy and we're really noticing excessively lots of sensory information. And of course, that on its own, that anxiety can become a barrier. It actually exacerbates your mental health issues and well-being issues, and on its own can become the problem. So even though it may be not the start of the issue, maybe it started from elsewhere, whether it was from something that happened to you in the past, whether it's something which we've already discussed from other presentations, you know, to do with cost of living crisis, to do with pandemics and things like that. Then, of course, they can be the initial problem, but then the anxiety exacerbates. And then, of course, as I say, that itself needs managing. So I wanted to bring that context into it because it's important to understand, well, what are grounding techniques going to actually do, or how can they actually help? And it is effectively about bringing us into the moment. Now, as I mentioned before, we can ruminate, we can cogitate over lots of information, and it's like a washing machine up here. It's just overwhelming. And we find it hard to focus and hard to concentrate. We find it hard to actually motivate ourselves or do anything, even to function in general when it gets so severe. So grounding techniques can help actually to reduce that. And they are, as it says on the slide, they're a form of mindfulness, the deliberate and purpose focusing of your attention. Of course, there are differences. Mindfulness and grounding techniques are different, but you know, there are overlaps and similarities. So, of course, anxiety can be drawn through our emotional mind, and it can be influenced by, triggered and things by those kind of really intense feelings that we may sense. And of course, grounding techniques help to activate the more rational cognitive side of the brain and help overall reduce that overwhelming impact that the anxiety and those emotions can have. It's important to acknowledge, though, that these techniques do not make all that negative thing disappear. You know, there are plenty of things out there that we have no control of, or plenty of things that impact us, of which, you know, we didn't start, or it happens to us. As we've already mentioned, COVID, cost of living, things that other people have done to us and all that kind of thing. So rather than think we're going to magically make all those things disappear, it's important to acknowledge actually what we're going to do is help ourselves in our response to those things, how we're going to be able to manage ourselves, manage the difficulties, the stress, the feelings, and be able to tolerate and cope with them more easily. That will then allow us to step even further and move on to other areas where we can access support and do more to help ourselves. So this is the classic grounding exercise. And now if you would like to, we're all welcome to do this. This is very, very basic. It may take a little while, but it's all about just bringing ourselves into the literal physical moment. So activate your 5 senses. So effectively, rather than being on autopilot, just going through this, just listening to the screen, drifting off, paying attention, thinking, what am I going to have for tea, or being distracted by cats or whatever it may be, bring yourself literally into this moment and just label the things around you using your senses. So name 5 things that you can see. So for example, I can see a cushion, I can see a chair, I can see a brightly colored poster, I can see a pretty funky clock there, if I'm honest, and I can see a beautiful mural painted on the wall. And then same with the 4 things that you can touch, that you can physically feel. And it has to be things that you can actually feel. There's no point saying, I can touch that over there. And well, not unless you can literally feel it. I want you to literally touch it in your hand. And touch doesn't just come from hands, of course. It could be the clothes that you're wearing. It could be the seat that you're sat on, or even the glasses that are resting on your nose. Take in the sensation that you're getting from that, the textures, the feelings, the warmth or coldness, the hardness, the smoothness, all those little details. And then 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Now, as I said, this is one of those kind of basic fundamental exercises, which a lot of people have probably heard of. And we've got to be honest, if when we do these in sessions, I always say to people, actually, that's okay as a preventative measure. But if you're actually beyond that and you're finding yourself finding things really, really difficult, we need to break it down to a more simplistic thing, because it's very, very hard to then try to remember all those steps and all those things that are going to work for you. So why not just focus on one area? And that may be just focus on the things that you can see. And rather than just labeling things you can see, add a little bit of detail. What about naming things that you can see that are blue? Just focus on the colours, and especially on colours you may yourself find pleasing or calming, things that don't, cause you to feel or heightened or triggered. And so if you look around, again, I can see a blue chair, I can see blue carpet, I can see a blue painting. And just help yourself, bring yourself into the moment. Take yourself out of your mindset, out of your head, and bring yourself into the actual here and now. The thing is, of course, those basic grounding techniques are very helpful and they can have immediate responses, and they can be really useful in that way. Practice, practice, practice is important. But as I've already mentioned, it's also about adapting. And going back to that initial point that I made at the beginning of when I was talking, it's about the individual, what works for you. Now, if feeling things could actually trigger because, certain sensations, certain things. I know, for example, a lot of people don't like touching cotton wool. That can be really quite, it just makes me feel uncomfortable. So move on to a technique that is going to be helpful for you and practice it. And as I put on this slide, actually, we do have more than 5 senses. We have thermosense, the ability to be able to determine and detect temperature, or even your sense of balance. And research has been shown with things like sense of balance, that grounded technique can be really helpful in bringing people out of disassociation. So as I said, if you've ever been in that state of mind where you've been totally lost in your thoughts, your judgments, and then you're suddenly finding yourself a little bit spaced out, and you don't feel like you're yourself, or you're inside yourself, or you're looking out of your own eyes and things. If you just slightly raise your foot off the ground, and again, we've got to be realistic about abilities. If people have any issues with their balance already, or if people have issues with their physical selves, then it's about understanding what works for you. But that kind of thing can then just help you realize, well, I really have to focus on not tipping over. I really have to bring my concentration into this moment and help me from overwhelming myself with the thoughts, the judgments, the worries of anxiety and stress. If you want to try it right here, right now, you could have an exercise where you can basically get your finger, your hand, and just try to balance something on it. Maybe it's a pen, or if you've got a feather at hand, that can be really handy. And it takes a little bit of an effort just to really focus and concentrate. Say, I didn't even manage to do it there. Just to be able to bring yourself into this moment and concentrate. Now, I can't see anybody, but I love the idea that everybody right now is just there getting a pen and just trying to balance it on your hand there, just to see if you can actually do it or not. But it is important. I can see Simon. It is important to use these things, to adapt these things to what is going to work for you, because there's no point failing and then thinking that's it, it's never going to work. It's trying to make it something that is helpful for yourself. I think I'll pass back to Simon now. Thank you.
That's Brilliant, Ian. Thank you so much. It says, as a sort of someone that works as a therapist as well, these ground techniques do work, but it is about practice, isn't it? It is about sort of not trying to do these when you are in the midst of an anxiety sort of attack, or when it's really present, but to actually do these on a day-to-day basis, so you get used to it. It's that toolkit that you have, and these tools for certain things, because I could imagine the anxiety of searching around for a feather, but actually you can balance anything on there. Brilliant. That really good. And I'm sure this is going to link nicely in as we kind of move sort of swiftly on to Amanda, if she is there. Let me just see on my view there. Yeah. Hi, Amanda. So I'm going to just pass straight over to you. And again, I'm really excited to hear what you've got to say about the sort of polyvagal work, or the vagus nerve. So over to you. And I'm going to get to say you're on mute, Amanda. Just whilst Amanda sort of gets herself settled. Yeah, I was just thinking about another grounding technique, and Ian has probably come across this before, just the sort of breathing with, and the sensation through your hand as you do that, as you breathe in and breathe out, just slowly in line with your breath. Just a nice little sensory technique there. Amanda, are you with us? Yeah, I think we're having difficulty with Amanda. I feel like one of those newsreaders now that's gone to the news report, having difficulties there. I wonder if maybe we could skip ahead a little bit whilst Amanda gets sorted out, and maybe come back and do the South Tees Wellbeing Network bit, if that is possible. Yeah. Right, that's brilliant. So thanks, Mark, for doing that. So yeah, if you could just sort of put that on as the big slide, we can have a little look. I love these virtual things. I don't know whether anyone's had that experience where someone's taken over their computer, to do some checking and things like that, and it feels really weird when that happens. And again, as a normal thing, I've kind of noticed that tension occurring within myself when that happens. So I'm kind of happy to talk through this. As I mentioned earlier, the South Tees, or the virtual network in South Tees, it's for employees and volunteers from health and wellbeing services. And it's about connecting, exploring and acting on local wellbeing issues together. That's actually really quite exciting and interesting to think about, because it means we can be reflexive to the things that are going on within our locality as well. So I think it's a really exciting opportunity there. It's open, as we mentioned earlier on, to local workers, volunteers. And again, I think what's really important here is that at any level. So right from those people that are involved in strategy to those people that are, for want of a better expression, at the coalface, who are able to bring their lived experience to issues and to talk about that and to support the development and support of other people. So what we've got, and again, if you sign up for this, it's about the personalised newsletters. Really interesting stuff. I mean, I know Richie Andrew, who's very much involved with this, and the dynamic content email. So there's lots of resources, there's lots of information, there's information on podcasts and the such like that are there that help inform us as to what we're actually, or what it's about. And it's about sharing. It's about communication and sharing. Already today, in the sharing that's gone on from participants, has been really exciting as we find out more about what's out there. Now, you all may well have known the stuff that was there already, but I've got to say, I found out some new things, some other things that I'm going to be able to bring to bear, both within the training that we do as part of the Teeswide Training Hub, but also within other areas of training and work that I do. Again, virtual and face-to-face events. And that's been lovely to get back to some face-to-face events as well, at networking that we have as we move into the kind of, away from the virtual world and into, in inverted commas, the real world. Yeah. So we've got the website, that's the website there, helpful features, service directories. And again, these are so important. You don't have to hold these numbers in your head. You don't have to remember them. There's a website there that you can click on and access that information and pass on to colleagues as well. Okay, I'm just moving me out the way there on the screen. Yeah. Members' wellbeing in practice, free wellbeing sessions for members. So please visit the website there. So take a note of that, if you will. www.teeswellbeingnetwork.org. Quick 2 minutes, get that into your browser, have a little look, and do sign up and support the work that's actually going on there. It's really exciting. It's lovely to be hearing the information from the South Tees Wellbeing Network and being involved with that. So I don't know whether anyone is available, Mark or Ian, who would want to sort of chip in anything more, or we can move back and see if we can get Amanda back onto the screen so we can hear about the.
Well, Amanda's just come back on there, Simon. So let's give this a go. See what we can get. We can get it up and running. So
I'm back. Hello. Can everyone hear me? That was just a little bit of a struggle. So apologies for that. And you know, IT does give me anxiety. So there you go. Right at the last minute, it failed me, but I had a mess about with it, and fingers crossed we're okay now. No slides or anything from me. It's very quick and simple what I've got to say as well, because like I say, IT does give me anxiety. But I was going to talk today about the vagus nerve. And one of the previous roles that I had, at the minute I'm working as trauma-informed lead for South Tees Changing Futures, where I'm implementing trauma-informed care. And I've always had trauma in mind when I've been dealing with the service users I've dealt with in the past. So one of my previous roles was at Home House Prison, and the amount of anxiety in the men that I worked with there, it was due to what happened to them, a lot of it, and obviously their surroundings and the anxiety that caused, whether it be when they were out and about on socials, or whether it was when they were in their cells with people that they didn't particularly want to be with. Plus, they were always anxious about family members, girlfriends, things going on outside that they had no control over whatsoever. So what I used to talk to them about a lot was easy ways for them to be able to feel more resourced at the start of their day. And one of the things that I used to talk to them about was how to raise the tone, or what I like to call sort of the petrol gauge of their vagus nerve, because the higher the tone and that petrol gauge, then the more resourced they will feel for the day and the less anxious they would feel. So they would get a really, really good start to the day. Now, the first thing I used to say to them was, if they got access to the showers, was to try and have the last minute of their shower freezing cold on the top of the head, because the vagus nerve does like it, and that can help raise the tone of the vagus nerve. And you know, this is something that now we talk about when it comes to cold therapies and things like that, you know, the feeling of cold on the top of our heads actually does help raise our mental health and our well-being. So this is something that I've been talking about for years with the men in the prison. So I used to say to them, try and get cold water on the top of your head for about a minute if you can, and that'll raise it. If they couldn't do that, I used to just tell them to use the sink in the cell and try and splash their faces with water as much as they could and try and get it as high on the head as they could. Other things that vagus nerve likes, because your vagus nerve is to where it is, it's right at the back of your head. and it loves vibration. So I say to them, when you're brushing your teeth on a morning, after you've brushed your teeth, if you can gargle, gargle. And the best thing to remember to gargle, because we all know the song, is Happy Birthday to You. So you can imagine the men in prison cells gargling Happy Birthday to You first thing on the morning. The next thing that I used to say to them as well was, rather than, if they had a tune in the head, rather than just keeping it in the head or singing it, was to hum it, because again, that vibration and where it is, the vagus nerve really, really likes it, and it will raise the tone of the vagus nerve. Now, the more that tone's raised, the less anxious they'll feel at the start of the day, because what our vagus nerve does, and for anyone that's ever had a panic attack, I used to really suffer with them in my early 20s. And they're horrific, because I used to think I was dying. And what the vagus nerve does, it's much like Las Vegas. So Las Vegas lights up the strip. Well, the vagus nerve lights up all of your major organs. So when people are having panic attacks and things, it's the heart palpitations, it's that breathing, because it's your lungs, you feel like you can't get your breath, it's your stomach churning, it's all of those type of things. So the more resourced they felt on a morning, and the higher the tone in the vagus nerve, the better start they had to the day. And a lot of them have, because it's so quick and easy to use, they would use it, and I got so much good feedback from it as to how they felt. And there was one guy that I worked with who used to have lots and lots of panic attacks in his cell every day, and he would use this every time he felt like there was one coming on, and it would actually stop his panic attacks. Some of it could have been distraction, because we've talked about grounding techniques, which I used to use with them as well, but some of it could have been that he was actually feeling that tone up of his vagus nerve, and just feeling a little bit more resourced to be able to deal with things. I've also used it in the community with a lady that was using illicit Zopiclone. Asked her to just try it. She tried it and she thought it was like magic. She absolutely loved it and saw a difference. So it's much like, you know, we've talked about with Ian, with the grounding techniques. It doesn't work for everybody, but it is worth a try. And I think for yourselves on a morning before you go to work, or for service users to offer it to them, if we can just feel that little bit more resourced before we start our day, then there'll be less chance of any anxiety coming in, and we'll just feel a little bit better as we go through our days anyway. So that's me. Back to Simon.
I'm on mute. I've just turned myself off. I did it myself. Well, Amanda, that was fabulous. You know where my head went, and there's a connection there. Strangely, myself and Sandra at Golden Tree, we're laughter yoga teachers. And one of the things that we do within some of the laughter yoga sessions that we do is a humming meditation. Now, I've never made the connection actually between the vagus nerve and the humming meditation, but it is it's such an amazing tool, and there's something about the resonance that you get within your chest, and actually to do it in a group is lovely. The tone is absolutely fantastic. So yeah, loads more information, isn't there, coming out in terms of trauma reformed approaches, what's happening in the polyvagal therapy. It's such a fantastic technique. So thank you for that. I feel I'm kind of quite fired up and engaged with everything that people are saying. Wonderful. So thank you for that. Now we've got a video, and I'm sure there'll be questions that people will have, but we've got a little video now coming up. I'm going to hand over to Mark to sort this out. But Leigh Trimble, the operations manager from Red Balloons, has got a video, and I believe there she is. So this should just play, and I will leave you to it. Yeah, folks, I don't think we've got any sound coming through on this. I'm not. Are you? If you're on mute, Mark?
Yeah, let's give that a go, Simon. Again, I'll just reverse that back.
Yeah.
Yeah, let's try that again.
Hi, I'm Leigh. I'm the ops manager for Red Balloons. We're a small charity based in Stockton, covering Tees Valley. We use lived experience to support people with their mental health and encourage them to use physical activity to improve their mental and physical well-being. Rich has asked me to do a small video a short video talking about anxiety and how that's affected me in my life, and how I deal with that. He's asked me to keep it to about 3 minutes, so I'm either going to have to talk very quickly, or I'm going to go over time a little bit, but I'm sure Richie won't mind. So anxiety has been a constant for me, really, throughout my life, coupled with some periods of serious depression. I only realised that anxiety had been with me since probably my childhood, a few years ago, and that was probably when I became involved as a peer supporter, firstly as a volunteer for Red Balloons, and then latterly as a staff member. I'd had periods of where I was diagnosed with anxiety and depression, probably three serious episodes throughout my life, with the first one being in my late teens. And I felt and I thought that once the depression had lifted, you know, I'd had treatment, various different treatments. Once the depression had lifted, then the anxiety had lifted with it, and just sort of carried on with life. But felt very strongly there were some issues that I just couldn't deal with, and I thought that was a failing in me for a lot of years. I thought it was a weakness, particularly based around a work situation or work situations. I would become overwhelmed sometimes. I would back out of things at the last minute. I would make up excuses. And, you know, that carried on into my personal life as well. I had a conversation with a friend a few years ago who said, she couldn't believe the change in me in terms of doing lots of different things and getting out and about a lot. She said, what you always used to say to us was you were too tired to come out on a weekend. So, you know, I realised, as I said a couple of years ago, that anxiety had been something that had been with me all of that time. And, you know, it wasn't a weakness. It was simply that that's what I was dealing with, and periods of my life, throughout my life, had been periods of anxiety. So that helped actually when I realised that, when I looked back. It helped to give it a name. It helped me to realise that I'm not weak. In fact, nothing could actually be further from the truth. I just deal with anxiety, and quite often I can cope with it. I can keep it in check. It's always there to a certain extent, but there are times when I feel really strong and I feel really resilient, and it doesn't even come into play when I've got something I need to do. And then there are other times where I'm triggered, something will trigger me, and I then have to use all of my tools and try my best to keep it under control. The way I deal with it is self-care, and self-care is different for all of us. I also tell people that things make me anxious now, and that's only something that's come about in the last couple of years. So I'm not afraid to say I've got anxiety. A lot of people understand it. A lot of people have it, and you may never know because they're dealing with it and they're controlling it. In terms of how I deal with it, my tools that I use, exercise is the main one for me, and has been. I do a lot. I run, trail running particularly when I'm not injured. I walk, I hike, I like to be out in nature. I like to be by water or in and on water, so I do cold water dipping. I love swimming in lakes, seas, rivers, in the swimming pool. Again, that's the exercise. I love a hot bath. You know, that might sound like a cliche in terms of self-care, but I love a hot bath. You know, that soothes me if I can't get out and run or swim. I like to lie on the sofa under a blanket watching Netflix, you know, switch my brain off and watch something on the TV sometimes. I don't read as much as I used to, but that used to be something that really, really helped with my anxiety as well. So that's, you know, self-care really. The other thing I think is very important, the other thing that I've learned, particularly in the last couple of years, is that I step back if I need to, if I'm tired, if I'm feeling overwhelmed, if anxiety is rearing its ugly head, then I'll often postpone a meeting. Obviously, service users are always a priority. We'll never postpone anything with a service user. But other meetings can wait. You know, if they can wait till next week, then I'll postpone them and I'll rearrange them. If I feel I've got too much to do in a day and I'm already feeling anxious and overwhelmed, then I will step back and I will postpone things. And that to me is the ultimate self-care. And that's something that it's taken me a lot of years to learn, but it's something that's very, very important. Thank you.
Wow, that was fantastic to hear. I mean, I remember as Red Balloons started up, working with one of the members of staff there, and what an important message about self-care. I think it's absolutely vital. The phrase that you often see on the socials that actually says, you can't serve from an empty vessel. And I think that is so important. I love the idea of exercise as well. I am a slave to the tyranny of my smartwatch now, and I've got to complete my circles. And it is important that I get my 30 minutes of exercise in, or brisk walking each day. And I'm just going to give a big shout out to something that I love doing, which is lino cutting and lino printing. I love a mindful hour of just in the day that is just as important as everything else that I do in my day, because it helps empty the things that are in my sort of teacup, but also gives me the resilience of being able to manage. So I'm going to invite everyone back in now, and if we can have people's cameras on if possible, and so we get a lovely quilt of fantastic faces. And I'm going to invite any questions coming from sort of the people that are on there. Got a couple that I can see already, and Claire, maybe you might be pinging some more over to me. We've got Kelly Hall. There's a question here that says, are there any grants to support clients to buy white goods? So I don't know whether that will be appropriate for maybe either Sarah or Stacey thinking about that.
There is some help. So there's the Greg's Hardship Fund, where you can help apply. Stockton Borough Council have got a welfare assistance scheme where you can apply for some, and there's other grants available. Most of them you need to go through an organisation for them to make the application for you.
Great, that's fantastic. And I'm assuming that more information could be from yourselves if people wanted sort of those forms or grant applications, and you would assist people?
Yes, a lot of them are done online, and then we do a supporting statement that goes with them.
Great, lovely. Thanks very much. Another question, this is from Ian, and this is directed to, I suppose, all of us. I've already said about my lino cutting habit, but for each of the panelists, what top well-being tip that you practice, I think this is what he's saying here, what that you practice, would you recommend? So let's just go, I'll go from my screen there. Kat, you're up first then. What do you do? What's your top well-being tip?
So things that I do for my own well-being is I've got an allotment. So I love being outside in the garden and getting my hands in the dirt. That's my grounding techniques. Also, you might find me in a sauna on a beach, jumping into the sea every now and again. A few people have been doing that recently around here, which I do quite like to do. And yoga, when I do it, like I go through periods of doing lots of yoga and then not doing it for a while. But I think the biggest one for me is like a mindset thing, is that it's not easy for me to do this at all, but it's trying to accept whatever is, instead of trying to like get a definite outcome or trying to anticipate what's going to happen. Sometimes I have to check myself and really just think, just let it go and just be with what is, instead of trying to control things or try to work out what's going to happen. So yeah, mindset and getting outside, I think.
That's great. Thanks, Kat. I often think about that as well. I often talk about some of the things that we talk about in terms of grounding techniques. They are incredibly simple, aren't they? But not necessarily easy to do. And I think it's one of those things in terms of the practice. And I love the thing about allotments. But in fact, again, putting that with the cost of living crisis, I don't know what it's like in Teeside, but there's news reports about allotment spaces sort of trebling in terms of costs to rent. So again, it's that river, isn't it? The choppy waters of that river that people can be in. But let's move around. Sarah, what top tip do you do?
I think very similar to Kat, actually, so I won't repeat all of those, but the big one for me is sleep. If I don't get enough sleep, then yeah, it's a downward spiral. Sometimes it's a vicious circle because sometimes there's things going on that then stop you from sleeping. But yeah, for me, it's trying to make sure I get enough good quality sleep.
Lovely. Yes, so important that we think about that. And again, I notice the sort of tension and anxiety when you don't get sleep, and how you can lie awake being really angry with yourself because you can't get to sleep, and you've got to get to sleep, and you can count the hours down. Yeah, how do you let that go? Brilliant. Thank you, Sarah. On to you, Ian. Come on, you should have some bimblers doing what you do there. Come on.
Well, there's too many, to be honest, but for me personally, I'm going to be very general here, actually, because effectively it is just about making sure I'm taking time out for myself, because certainly if you work and certainly if you're putting other people first, we kind of neglect ourselves. And I posted in the comments there, self-care is not selfish, and we forget that sometimes. But in social kind of situations, I'm actually quite an introvert, and I need to make sure I'm taking time out. So I'm just either doing things on my own or doing things that I want to do to recharge the batteries effectively. And that could be anything from mindfulness to watching my favorite TV show to listening to heavy metal, which is my favorite type of music. So, you know, each to their own.
Excellent. Oh, I love that. And I love that idea about introversion. When we talk about introverts and extroverts, it doesn't mean you're antisocial. It's just where you get your energy, isn't it? It's what you need to top up. So I think that's absolutely super. And yeah, and music, connection of music and mood. I love that. I've just been having the Idols on thrashing away prior to this. Just getting that. Okay, over to you, Stacey.
I'm a bit like Ian. I'm a real homebody. I love being at home. It's much nicer now the sun's out, so I like being in the garden. Unlike Kat, I'm not very good at gardening, so I don't get my hands dirty, but I love being out there in the sun, in the nature, and it's just switching off from my phone. It's a big thing for me that I need to do.
Brilliant. And isn't this interesting when we think about anxiety, as you're saying, Stacey, and the allotment or wherever it is, about that safe space? Something about safety and creating that safe space that we all need, and perhaps we're fortunate to have that. But how many people aren't? You know, there's now that don't have that safe space. Okay, Amanda, over to you.
Oh, where do I start? So I love the gym. That is physical activity for me, is just, that's a key to my mental health, really, especially after a day at work. Baking is my go-to sort of self-care. It's just some time out for me, something that I love to do, and then everyone else likes to eat. So it gives them sort of some happiness as well afterwards. But I'm very big on self-soothing, and I talk about it all the time. So I talk about, much like Ian, about your senses and how to fill your senses with things that you really like. So I like to watch cat videos on Instagram. I think they're hilarious. So I watch lots of those if I need to self-soothe. I have a dog, so I love cuddling my dog, stroking my dog, cuddling my kids. I love musicals, so I put musicals on and me and my daughter sing and dance about, because rhythm is really good for regulation as well. So we have a dance about in the kitchen, and it's just really about, you know, being in your safe space and filling it with everything that you like, anything that you like to touch, taste, smell, hear, see. Just fill your day with that when you come home from work, and just, you know, really fill that bucket up.
Yeah, I think that's a super thing. So many things. This is making me think about sort of gratitude as well, and the importance of actually finding things that we might be sort of grateful for, and that they can be simple pleasures. One of the real pleasures that I get is getting into bed on the night. And maybe I'm a little bit weird here, but I love cold sheets. I love it when I get into bed and those sheets are cold. And that's something that I feel really grateful for. And we sometimes recommend and suggest on training that people do little gratitude jars, maybe writing 1 or 2 things that they're grateful for. Write it down, stick it in a jar, and then at the end of the year, tip that jar out and look at all the fantastic things that we can be grateful for. The small things that might be there. Lovely smell, warmth on our skin, things like that. So thank you for that. I noticed that in the shade, we've got Mark and Claire. I don't know whether they want to pop in with anything that they do. but the camera's not working and things like that, just putting people on the spot.
Absolutely, Simon, the camera doesn't work. So what I'm going to do is I'm going to flash across to Claire to answer that question. So I'll back away as quickly as possible.
Hi Sam, thank you. Thanks to all the panelists as well. That was really, really good to listen to. I have got a question for Amanda from Suzanne. She's a menopause coach and she treats a lot of women locally and nationally going through perimenopause and menopause, struggling with anxiety. Sorry, it's a really long question, I'm just going down. When they have not experienced it before, and many that have prior to menopause. So many mental health professionals at present don't generally consider it as part of their conversations, unless they have experienced it for themselves. And we know that this can often lead to prescribing anti-anxieties or antidepressants instead of HRT or other menopause-based solutions. What are your thoughts, Amanda, around menopause and anxiety and how this can be tackled more in the mental health profession?
Oh, good question, because this is something that I'm actually suffering with just myself, to be fair. So it's pretty new to me coming into this perimenopause part of my life. And what I'm finding is brain fog is the worst thing for me. So doing something like this today, normally in the past hasn't bothered me, but I get quite anxious about it because sometimes the words just won't come to me. And I think a lot of what Ian was talking about, because I use a lot of grounding techniques and things, but I think some of the quick win stuff, just to click you out of whatever it is that's going on in your brain can help. So I said to somebody the other day about sitting, and if they can have something cool around them on the desk, particularly because hot flushes can be a thing as well. So it can help on both levels. And what I tend to do is I'll either, if I haven't got anything cold around me, I'll run my wrists under cold water, like freezing cold water taps, just because it can bring my temperature down, but it also helps me regulate. And sometimes it can just help my brain fog lift, because the more anxious I get about it, the worse it gets. It's almost just like this block in my head. And it's not particularly a subject I do know a lot about, but just from things that I use in everyday stuff that I do with the people that I work with, I would say that those are really good things. I think self-care is definitely, I've had to be very boundaried recently, and because I'm getting really tired. So what I've had to say no a lot more and be very boundaried about things. Or if, much like what was talked about with the lady from Red Balloon, if I feel like I'm too tired to go to a meeting that I've said yes to, I've had to maybe reschedule it and be really fair to myself and look after myself a little bit, because if I'm not resourced, I can't do the job with everybody else that I'm working with. So I really have to look after myself, and it isn't selfish, it is self-care. So I think, you know, all of those sorts of things really help. Another thing that I do that can help with sleep and anxiety is I do auricular acupuncture. So I would say for any women that are suffering, look it up and try and get some help with that, because everybody that I've done that with, they find it really useful, particularly for sleep. They'll have a few good days, a few good nights sleep. And I think if you've got good night's sleep, that fills that bucket up and you feel a lot more resourced to be able to go about your day, probably less brain fog because you're sleeping well. So lots of different things, probably much like what we would use anyway every day. But, you know, as I'm going along myself in this new phase for me, I'm finding things that will work for me as well. But it's not a nice part of your life, really. And I just think it's what works for you and makes you feel better, but definitely self-care, 100%.
I think just picking up on something that Susanna's saying there about the thing about factoring it into the therapeutic conversation. I've got to say, as a trainer, I am noticing this conversation much, much more. So what I'm seeing and hearing about is much greater awareness of the impact of it, rather than it's something that happens. Well, yeah, it's something that happens, but it also has an effect on people. So let's get it in the conversation. Let's see where people are in part of their lives. And we've been working with a particular company who, I said the name of the company, it's Suez UK, the recycling and waste management company. And they have rolled out an enormous amount of training and information around menopause, inviting every member of the workforce to participate. So it's not just about the women, that are experiencing this at their time of life, but it's about everyone that's connected as well. So there's a greater understanding about what might be going on for people's partners when they've got this brain fog. And you're looking around for your keys yet again, Amanda, wondering what that is. You can't find the mute button and things like that. And it's a little bit more understanding about what it is that's going on. So I think we are seeing a greater increase in the awareness of it and the communication. And certainly within the training courses that we deliver on behalf of Let's Connect and the Teeswide Training Hub, it's getting factored in. I can't claim to be an expert on it. But again, this isn't about my knowledge and understanding about it. This is about the sharing of experience and what works and what helps.
Yeah, and I think it's very personal, isn't it, Simon, really, as to what works for you again. But I think the greater thing is what you're saying there is it's about other people understanding, whether that be the people that you're working for as well, you know, that flexible working's a great thing. And I think for some women who are really struggling, you know, that flexible working pattern and being able to have more time away from work if they need it, just to reach out, because that's what I'm finding is the worst thing is brain fog and tiredness. I'm just much more tired than I used to be. I won't give in to the fact that I'm getting older. I don't like it, and I can't do as much as I used to do, but it is that thing. And I think for people around you to understand that, but I think mental health awareness in general is getting better in every factor. And I just think, you know, for people that are struggling with, you know, the stigma of mental health or the stigma of you know, the thing that surrounds perimenopause and menopause, I think the more that understanding that's out there and the more leeway there is for, you know, people and their employers are giving them more leeway and understanding, I just think it's brilliant.
Yeah, I think so. I think there's certainly sort of a political element to this as well, in some way, in terms of people's experiences and what do we mean by things about aging? What are these periods and times of change in people's lives, and how do people feel and experience that? So it's really kind of I think it's just so brilliant that we're able to talk about this stuff and get that curiousness out there to explore. So yeah, thank you for sharing. Does anyone else in the panel have any comments on that? There's lots of great nods going on. I don't know whether anyone wants to add anything.
We've been doing quite a bit of work at the moment, or we've been asked to do work about money in the menopause, actually. So perhaps that's something for another day. But a lot of women are giving up work, which then has an impact on their pension. And their pension may have already been impacted if they've had to take time off work to have children or to bring up children. So yeah, so it's definitely a topic that's getting a lot more attention, and rightly so.
That sounds fantastic. I'm always, isn't it interesting how things connect? And I'm reading a book at the moment called Warp and Weft about sort of how things sort of connect together in some way. We can draw connections and joins between all the elements that we're talking about. So super, thank you. Any more questions coming through there, Claire? Because I can't, I've got a few things pinging up. A few people are having to...
We haven't got any more questions, Simon, but we've just had a few responses to what people who've joined us on the webinar today do to give themselves some self-care. Which is nice to hear that people are sharing those.
I love that idea that people are sort of recognising the importance. Those of us that work, and I think everyone sort of on this is working in the caring professions, supporting and helping other people. And I do think at times that we can forget. When Leigh sort of mentioned about sort of always putting the client first and see where she's coming from within that. But I also think there are times when we think about where is my head at? I know as a therapist, I have to kind of go, where is my head at the moment? Can I be fully present with what that person actually needs? Because I may not be in the best position. If I'm dealing with some trauma or something else that's happened in my life, am I able to fully support and be with that person? I don't know whether anyone else would have thoughts on that.
Absolutely, yeah, Simon. It's that classic of what we've all been saying. You know, if we aren't looking after ourselves, it's going to be very difficult to help other people and support other people, obviously. But it is that difficulty, you know, to get the balance right. And I think throughout all of what we've been talking about, balance is a key issue, because there will certainly be aspects of things where, as we've mentioned, we have no control of, and we have to experience, you know, whether it's things that we have to do that we're not too keen on, you know, pay bills and go to work, etc. But also making sure we're balancing it out with the things that we like to do and we need to do, because it's so easy to be overwhelmed by all of those kind of the expectation and where we want to be and what we want to do, etc. But the reality may be different. And it's being kinder to ourselves effectively, you know, letting ourselves have those moments where we can just go, no, this is for me and I need to do this, rather than constantly just doing it for other people, like which we're all guilty of. Let's be honest. It's a classic, isn't it? The doctors make the worst patients, and mental health professionals, we're terrible at looking after our own well-being. You know, we'll just, oh yeah, it's 9 o'clock, I'll get that paperwork done now. So
absolutely. I came across recently, I did some training around mindful self-compassion, and very much about how do we talk to ourselves. And what I really love, and I use this all the time, both with myself, is just a little soothing touch, and a gentleness around sort of what is happening. And I do share this. I was talking to a client about this and said, you know, the soothing touch, just gently put your hand on your chest, feel your heartbeat, feel the warmth. And she went, okay, you seem to be slapping that a bit too hard. It's a soothing touch, not a punishing touch. So just God, yeah. And it's how do we talk to ourselves? How do we treat ourselves? It's just so important. Folks, if there are no more questions.
Yeah, sorry, we have got one more question. So a question from Emma for Sarah. Sarah, do you have any information on children's pensions, please?
We don't have any information on children's pensions. Do you mean about parents paying into sort of savings accounts for children?
Possibly.
But we do have quite a lot of information on the Money Helper website, and actually on the Money and Pension Service website we do an awful lot. We've got a whole strand of work around children and young people, which is about different techniques for parents talking to their children about money and more about financial education. But certainly on the Money Helper website there'll be a lot of information about different sorts of savings vehicles and different things that maybe parents can look at for children if that's what you were meaning.
We've got just one more question's come in. Are clinical mental health support and self-care information and resilience balanced enough in the messaging to public? Should more be done for this? Who could answer that?
I think that's a really interesting question in terms of the language that we use, and do we understand sort of, or what is the general awareness of the language that gets used, because it becomes quite confusing, I think, at times. I don't know what other people feel about when we're talking about mental health or mental ill health or resilience or well-being, and where the onus of responsibility comes. So I think maybe that balance could be a little bit better, but I'm going to, Amanda, do you have any thoughts on this, working as a sort of trauma-informed therapist?
Yeah, I mean, for me, it's all about, you know, as simple as possible for people, because when it comes to trauma-informed care and the approach, it's all about creating a safe space for somebody to trust you and to be able to work with you. And the language I always use, I mean, I'm not very fancy pants when it comes to my language anyway, which is why I did all right in home house prison. But I tend to use the simplest language and the simplest techniques that I can, because they're the most effective. And the biggest thing for anybody to be able to recover is connection with a human being who sees them, who hears them, and who genuinely cares, wants to help them. And I think that's key. And you know, it's taking that power balance out of a relationship, and really just having that one-to-one conversation with somebody. A lot of what I do is unpicking the person and helping them understand that actually their normal is okay. You know, they're fine. They're different. We're all different. Our normal is from our experiences and our upbringing, and that makes us who we are. And a lot of it is taking away their guilt and shame and just making them feel okay about themselves. And from there you can do some really cool work, I think.
I completely agree. I think it comes back to what we were saying sort of a little bit earlier on. That it's not what's wrong with the individual. There's nothing wrong with the individual. It's what's happened to the individual. And I think some of the pathologizing of experience can be actually quite problematic, you know, that we have when we think about grief, when we think about abuse or trauma or whatever that may have happened. It's a normal reaction to abnormal events that we're seeing. So it's really interesting. I think that this is almost could be another conference, couldn't it? Another webinar on sort of how do we use language? How do we think about this? I'm wondering in my head about moving away from the term mental health, and I very often talk about sort of psycho-emotional health.
Yeah, and I just think we're too quick to label people. You know, again, going back to the prison, the man would say to me, "I've got a personality disorder." I'd say, well, what's that then? And they didn't know. They were just given the label. And I said to them, right, let's just strip that back. This is who you are because of what has happened to you and the experiences you've had. And now you've got certain behaviours because of it. Yeah. That's what it is. So it's you.
Yeah, Amanda, I don't look in the DSM-5 because I know I'll find out what's
I know.
Absolutely fantastic. I don't know whether that answers that question fully enough. Ian, is there anything you want to add on to that?
Yeah, just to kind of highlight what you've said, plain English is crucial. I find a difficult word for a lot of people is clinical. You know, that immediately makes people defensive and makes people think of there's a power dynamic for a start. You know, you're the professional, I'm just the patient, and that can be very difficult. But what we're trying to do is break those barriers down simply by the terminologies, the words we use, the way we interact, and make people understand that you're the expert of the experience. We may be an expert in the mental health side, but there's a balance here that we need to adjust, and that can be really helpful. But always look to the individual and what works for them in the language, in the what they understand, and how to actually promote and expand upon that to be helpful for them. But yeah, there can be an imbalance sometimes, but it's a thin line to tread.
Lovely. Okay, thank you. I'm just going to take this opportunity to remind people that this has been recorded and it is going to be available via the Let's Connect website and the South Tees Wellbeing Network within the next week or so. And do sort of push those out on your socials as well, so that more and more people can actually hear and listen to the fantastic debate that and discussion that we've had. I'd just like to thank all of the panelists for their contribution today. So Catherine O'Neill, Sarah Murphy, Stacey Sowerby, Ian Meredith, Amanda Chalmers and Leigh Trimble via video. And once again, thanks to Mark Setchell and Claire Yeoman for their behind the scenes work, and Ian Caldwell for sort of shepherding this through as well. So thank you so much, everyone, for your focus and attention. If anyone's got any more comments that they want to put in, or please email Let's Connect or join us on the socials, and let's keep that debate and discussion going. So thanks very much, everybody.
Thanks now. Bye.